Hi folks, Dragon again. First aid uses of those test tubes, and there's a few miscellaneous uses too. Okay, this one here I've got medical salt. It's the same as non-iodized table salt or sea salt. Can be used for medical reasons as well as putting on food. A good way to do it is in a test tube like that. That's the same one as in the previous video. Glucose powder. Sometimes when people are under a lot of physical activity, heavy stuff, their blood glucose levels can drop quite considerably, either due to an underlying medical problem or the fact that they haven't been eating properly during the day, like carbs and things like that. And if a glucose level drops down to a low enough level, I won't give you the exact figure because I'm not a medical person, we can look it up on the net, due to physical activity or an underlying medical problem such as diabetes or some other underlying medical problem, then that could be in serious trouble, virtually slipping into a coma. So glucose is one of those things that mix it up with water and give it to them orally through the mouth, and that should help. I'm not saying it will, as I said, I'm not medically qualified, but that should help bring their blood glucose levels up fairly quickly. That's the powder form of it. An antiseptic in Australia here, it's called Dettol, comes in a bottle like that. Take the lid off. You can use a cotton bud, or like we've got here, or some cotton wool for any external wounds. Just put the cap on again. Those are the two from the last video, and you can see there's no wet spot on the table, so they're not leaking. Same with the Dettol. Citric acid, okay. Vitamin C, powder form, mix it with water, drink it, vitamin C. If you haven't got any readily available vitamin C rich food items available, that's another way of doing it. Saline solution. I made this up in powder form. Again, thank you Scottish Lass for your homemade saline solution. If you look at that post up on the forum, folks, Scottish Lass, it was in liquid form, had to be refrigerated, and after a couple of days she highly recommended that it be tossed. So in the field, best way to carry it, I thought, was to make it in powdered form. If you need to flush a wound or something like that, put it in some sterilised water, dissolve it. I always carry one of these in my first aid kits. Put the saline liquid solution into that and irrigate or flush the wound with this syringe. So thanks again Scottish Lass. Codeine. Okay. What I'm dealing with here is it's over-the-counter medication. It's not prescription medication. There's about 8 milligrams of codeine in here. It's painkiller with paracetamol. So in Australia here they come in blister packs, which aren't very rugged. I've had problems with them in the bush. Blister packs break or puncture or something like that, and you lost the integrity of the medical stuff inside it. So that's another good way of doing it. You can also do it with paracetamol tablets. But please, and I emphasise this, please, with any sort of medication you put in these, read the instructions and adhere to the medical advice on the packaging it comes on. And I would strongly suggest that the medical advice that comes with any medication you put in first aid kits, whether it's this way or another way, packaging or whatever, that you put a note in there or off the side of the packaging reference the medical use dosage dosages, maximum dosages in any one day, and that sort of thing in with the medical kit, so that if somebody else picks it up and goes, uses some of this stuff, they can read the medical instructions on it and adhere to it strictly. That goes for prescription medication. The reason why I did it this way, I had a fairly long conversation with Sir Jeff last year after doing a video on these straws about crushing up tablets, paracetamol and codeine-based tablets, and putting them in these into a powder form. Now, the problem with that is, if you're using more than one tablet, you might put 2 or 3 in there, you don't know the correct dosage you're getting. If you put one tablet in there and just use it like that, as what they call an ampule, I think it is, that's fine. I didn't feel comfortable with crushing up medication because some of it's designed for slow release through the stomach. Some of it has protective coating on it to protect the stomach, like ibuprofen or that sort of stuff. So you crush it up, you've lost that coating from the outside of the medication for slow absorption into the stomach and reducing any damage to the stomach lining. So please be aware of that. Prescription medication, I would suggest you talk to your doctor or your pharmacist about storage in first aid kits like this. And another point is, what's your expiry dates on this stuff too. So mark it on there somewhere, the expiry date, and then turf it. Not worth the risk, folks. Okay, cover that one in a minute. Well, yeah, I'll do methylated spirits. Okay, and it's not reacting with the plastic in this. I've had this in here for about 3 days, and it can be used for sterilising some medical instruments, needles, pins, that sort of thing, and it can also be used in alcohol stoves for members that have got those. It can also be used as an accelerant to light a fire if you need to. Not always the case, but it's nice to know you've got it there if you're having trouble getting a fire going. Okay, hand soap. What I've done here is I used some gel commercial hand soap, mixed a bit of water with it to make more liquid so it comes out, for the purpose of this video. But you can use homemade soap in there too. Field hygiene, clean your hands. Okay. And the larger ones, I put some cotton balls in there. Use them for first aid or as fire starters. The next one is tea tree oil. And someone reminded me very well, the video I did on my injured finger, about using tea tree oil and or eucalyptus oil. So for the purpose of that, and thank you for that person who made that comment, truly, I've also included it in this too. They come in small bottles like that, very good antiseptic. And it hasn't reacted with the plastic and hasn't leaked. Cotton buds, these are wooden stick ones. I find these a lot better, a lot stronger than some of these synthetic ones. It's in there, it's sealed, keeps them clean, keeps them dry, and lots of applications, external wounds, that sort of thing. So you can get a few in there. Needless to say that the commercial packaging for a lot of these doesn't cut it when you're out in the bush and doing all sorts of weird things with your backpack. A few other ideas that I've come up with, and really with this whole test tube video series, on both videos, your imagination is the limit. Certainly test it. Some liquids may react with the plastic. I wouldn't suggest putting gasoline or diesel in there. It may react with the plastics. So you've got to trial it and see how you go with it if you want to go down this path. These ones, if you're using any battery operated gear, that's 2 AA's in there. Keeps them dry, keeps them clean. You can also use rechargeables in there if you've got a recharge that works off a vehicle or something. Your AAA batteries in there. So it protects them very well against all the elements, and certainly against any damage if these are crushed by accident or something like that. I might add, while I've got this too, I'll empty these out, is that these are pop tops off bottled water, commercial bottled water. These also fit perfectly on there. Okay. So if you're making up a solution, glucose solution, or some form of medication that needs to be sipped, that fits neatly on there and just through the mouth. And a person who's badly injured or might be semi-comatose, sort of doesn't drown when you pour it down their throat, they can sip on it very quickly, very slowly, and of course push it down and it seals it, ready for the next application. So that's another good use for these. That's a good fit. Just put it back in there. That's a metal cap. Okay, another use for it is kerosene. And I've had this in here for about 3 days. It hasn't leaked and it hasn't reacted with the plastic. Some cooking applications, as in some types of stoves use kerosene. If you've got a small lamp or something like that, you can also use it as a fire accelerant. And I know there's lots of ways of getting a fire going, but there are times when it's very, very hard, despite how skilled you are or how many different types of fire making tools and instruments you may have. It can be very difficult at times. So kerosene. Okay, in this one I put waterproof matches, green light matches. Okay, the heads of the match are waterproof, but the stick isn't, so something you got to think about. What I also did was I put the strikers in there. Just cut the strikers off the end of the box, off the sides of the box, and I folded them so that there's no risk, or reduces the risk of any accidental ignition of those matches in there. Now, the way to use these, just fold it in half, put it in there, pull the head off that match, good on you. Okay. Like that. So that's one way of storing matches with the strikers. The strikers I've found with a lot of matches in Australia, the biggest problem is the slightest bit of moisture. They get damp, they won't ignite the match. So that's another way of storing them. Fortunately, the head came off that match. 1 in 1,000, 1 in 60, I don't know. There's about 60 something matches in that tube. Another way of starting a fire tool. Also, you can put a very small sewing kit in there. What I've done here, it keeps it dry, stops the stuff from going rusty. Just wrap some cotton around a cardboard strip like that. That's a big needle for canvas work. If you've got any repairs to do your backpack or EDCs or that sort of thing. That's just cotton wrapped around a bit of cardboard. What I also did for some of the needles, just put them through a piece of cardboard like that. Much safer way to carry them. Empty them out of the tube. I've also got safety pins in there too. And of course, for us blind oldies, a threader could thread the cotton through the eye of the needle. So there's a few ideas anyway. You can put buttons in there, whatever you want to put in your sewing kit. Peroxide, did have a tube right here somewhere. Yeah, it's around here somewhere. Anyway, it's a mild antiseptic, which you can also use as another type of antiseptic. Paraffin oil, okay, for medical use, read the instructions on it. It's a laxative, so please read the medical instructions on how to use it. But also, dip a piece of string in there or a bit of cordage, light it with a match, and you've got yourself a very primitive candle. I tried it the other day with some jute string I used in the tallow candle video, I think it was. Burned very well. So that's a double use. There's a few ideas for you. I thought I might also add into this too. We've got these here. In Australia they're called paddle pop sticks, used by people who are into arts and crafts and small kids who do collages and things like that. You can fit them in there, they'll fit in there. Very good finger splints. This dragon, when you cut your finger, you didn't immobilise it. So after you dress the wound, bit of tape around there, immobilises the finger for some certain types of wounds, and certainly for a broken finger or something like that. So that's something to you might want to consider. Alright folks, that covers it. That's the medical side of it and some of the other uses of it. Again, I emphasise with all medications, codeine, paracetamol, any other the-counter medication, including prescription, please read the instructions and adhere to the dosages. And make sure you've got a copy of that in your EDC, your first aid kit, whatever, so that if somebody else picks that kit up and goes to treat somebody, they know what to give them and how much to give them. It would also be a good idea, some people have bad reactions to things like codeine. To put a list in there if you're in a family group or extended group of medical allergies to codeine, even iodine based stuff for antiseptics. Some people are allergic to that. Put a list in with your first aid kit or your medical kit, because remember, some of these people that you might be treating might be unconscious or incoherent, and you won't be able to get a word out of them what they're allergic to, whether it's codeine or iodine or some other sort of medication, and that sort of thing. So, and you've also got to watch that some medications will react with medications you're already taking. So it might be a good idea to have a listing for that too, for the people you know. If you're going to wander off and treat a stranger, then it's a risk, and it's a risk you've got to weigh up. That's all I can say about that. So, thanks very much, folks. I found these test tubes a much better way of carrying stuff. Very robust, impact resistant, can be reusable, can be sterilised in boiling water. So it may be a way of overcoming some of the packaging problems you've got with your EDCs, BOBs, backpacks, even in the backs of these vehicles. Because let's face it, this stuff was never built to be bounced around the bush in a bag or in the back of a vehicle. So, you know, it's a few ideas for you to throw around. Thanks very much.